Hello everyone, my name is Elodie Toulouse and I will be presenting my master's project entitled Golden Years Fading to Blue, the development and validation of an observer-rated assessment scales for signs of depression in demented elderly patients living in nursing homes, with my co-author Daphne Carrier under the direction of Professor Christian Rochefort. For an individual to be diagnosed with depression, they must present with a depressed mood or loss of interest or pleasure accompanied by at least 5 other relevant manifestations for at least 2 weeks. It is difficult to distinguish depressive symptoms from those of dementia as they overlap each other. These include persistent anger with self or others, diminished social interactions, or other symptoms such as irritability, retardation, and agitation. Consequences of depression or its misdiagnosis on patients include a diminished quality of life and an increase in all-cause mortality risk, in severity of cognitive impairment, as well as in misuse of medication. Related to those on the healthcare system, there is an increased annual medical care expenditure, as well as burden on staff.
There are many challenges regarding the assessment of dementia patients. This clientele presents language and memory function impairments, which can alter their capacity in the reporting of their symptoms. In addition, patients with advanced dementia are often verbally non-communicative. Therefore, traditional assessment methods are not always reliable due to lack of feedback and cooperation. There are many limitations in the existing assessment scales for depression in the dementia clientele, as some depression symptoms resemble those of dementia itself. Overlapping symptoms such as irritability, retardation, and agitation may lead to an overestimation of depressive symptoms by nurses. Alternatively, overlapping depression mood symptoms may lead to an underdiagnosis of depression by physicians. Considering that multiple nursing home doctors base their depression diagnosis on nurses' evaluation, a better detection of these symptoms by professional caregivers is necessary to avoid misdiagnosis. The objective of this study is to develop and initiate the validation of an observer-rated depression assessment scale for use with dementia patients. This study contains 2 phases. Phase 1 consists of a systematic review to define the concept of depression in the dementia clientele and to identify a list of observer-rated statements and scales permitting its measurement. Phase 2 consists of 2 steps. Step 1, a Delphi survey will be conducted with provincial experts to identify the statements to include in the scale and to target the best existing depression screening scale to measure each statement retained, in order to determine the content validity of the proposed scale. Step 2, the proposed scale will be tested with a convenient sample of 8 to 10 nurses working in nursing homes to assess the comprehensiveness of the statements and to determine the instructions for its use.
For anticipated results, our primary objective is the development of a valid observer-rated assessment scale for depression in demented patients living in nursing homes. The impacts of this research project will be to allow registered nurses to efficiently identify the presence of typical, atypical, and overlapping signs of depression in demented patients. This will also allow them to properly implement effective therapeutic interventions, pharmacological and non-pharmacological, and to do an efficient interdisciplinary management. This research project should allow a better recognition and consequent diagnosis of depression in dementia patients, leading to its optimal management and treatment. This will increase quality of care in nursing homes and should therefore positively impact patients and the healthcare system. Regarding patients, recognition and consequent proper patient care regarding their biopsychosocial needs should have a significant positive impact on their quality of life. Also, this will presumably result in a decrease in mortality risk and related health complications.
Regarding healthcare staff, overall improvement in the quality of patient care provided can stabilize and improve patients' health conditions and should lead to an increased feeling of competence and a decreased feeling of burden by staff. Finally, concerning the healthcare system, it is hoped that the optimal management of pathologies such as depression in the dementia clientele should have a positive impact on the patient's health status, consequently increasing overall quality of care and organizational performance, as well as eventually decreasing annual care expenditures.
The authors have no conflicts of interest to declare. Ethics approval will be requested in autumn 2021. Fundings for this research projects are from Professor Christian Rochefort's Research Laboratory, Canadian Institutes of Health Research, and University of Sherbrooke.